Good morning, students. Today, we all are going to learn what do you mean by hypertension and how do you treat it with the use of antihypertensive drugs, and what are the mechanisms of action in brief about the classification of antihypertensive drugs. So let's get started. Before learning the antihypertensive drugs and what is its action, we are able to understand the definition of hypertension and what are the classifications of hypertension. The hypertension includes it's an increase in blood pressure, such as systolic is more than 140 millimeters of mercury pressure, and the diastolic blood pressure will be more than 90 millimeter mercury pressures. Or if it is more than 120 by 80 millimeters of mercury pressure, then it is called as a hypertension or high blood pressure. There are different classifications of hypertension like essential hypertension and secondary hypertension. The essential hypertension is one of the most common, and 90% of the population who are affected with hypertension are considered to be in the category of essential hypertension, but secondary hypertension is about only 10% of the hypertensions are related to either endocrine or renal disorders. So, what is the cause or what are the risk factors and how do you prevent the hypertension without the medications for the treatment options? So, the reasons and the preventions for high blood pressure is either the gender or age, obesity, or genetics. In the cases of gender, usually males are affected as compared to females, like 60% and 40%. As the age increases, there is a chances that the high blood pressure might cause the person to be in a morbid condition, and the obese populations are having a risk factor for affected with a high blood pressure, and the genetic predisposition is one of the major risk factors associated with the hereditary factors from the parents to the offspring. If the medication is not prescribed or the non-medical therapy of high blood pressure is related to prevention, such as stop smoking, avoid alcohol, avoid caffeine, and avoid intake of salt and spicy foods. If the high blood pressure cannot be maintained in a non-medical therapy, that time the person needs to go to be prescribed with the antihypertensive drugs like diuretics, sympatholytic drugs, or vasodilators, angiotensin inhibitors, and some of the antagonists of it. So coming to the diuretics will affect on the kidney because the kidney and heart are usually interlinked to maintain the blood pressure with the one system called renin-angiotensin system. So usually in the cases of high blood pressure, the renin-angiotensin system is relevant to be considered for the treatment of high blood pressure. For example, thiazide diuretics, loop diuretics, and potassium-sparing diuretics. And another classification which is related to sympatholytic drugs as central acting anti-adrenergic agents, alpha adrenergic blockers, beta adrenergic blockers, and alpha beta adrenergic blockers. In the cases to maintain the peripheral vascular resistance, some of the vasodilators are used, so which affects the total peripheral resistance, which is affecting the cardiac output of the heart. Examples like nitric oxide releasers, potassium channel openers, calcium channel blockers, dopamine receptor agonists. And coming to angiotensin inhibitor and antagonists. Angiotensin converting inhibitors and angiotensin receptor antagonists are one of the major classifications for treatment of high blood pressure. Coming to its examples, ACE inhibitors are included in enalapril, lisinopril, ramipril, and captopril. ARBs, telmisartan, olmesartan, losartan, candesartan, and valsartan. Calcium channel blockers, amlodipine, felodipine, nimodipine, nifedipine, isartal, verapamil, and diltiazem. Beta blockers, atenolol, metoprolol, bisoprolol, labetalol, and propranolol. Diuretics, hydrochlorothiazide, chlorothiazide, chlorthalidone, spironolactone, and some of the vasodilators, hydralazine, minoxidil, sodium nitroprusside, diazoxide. Alpha blockers, terazosin, doxazosin, and prazosin. Central alpha-2 agonists, clonidine and methyl dopa. So these are some of the conventionally prescribed antihypertensive drugs for the different conditions related to high blood pressure and its management. Coming to its mechanism of action, the angiotensin converting enzymes are going to be affecting the conversion of angiotensin 1 to angiotensin 2 in the kidney. So what these inhibitors do, they are going to affect the lungs and the kidney so that it will block the conversion of angiotensin 1 to angiotensin 2, and which is responsible for vasoconstriction. So it will affect the vasoconstriction of most of the blood vessels and maintains the output of blood so that it will decrease the blood pressure. A next example, or the mechanism of action for angiotensin receptor blockers, usually the renin plays an important role in the conversion of angiotensinogen up to angiotensin 2 with the use of one more enzyme, angiotensin converting enzymes, as we have discussed earlier. But when the angiotensin 2 is already being produced or synthesized, it is either going to affect the receptor angiotensin 2 or angiotensin 1 receptors. Suppose if it binds to angiotensin 2 receptors, vasodilation occurs. And if it affects on angiotensin 1, that time vasoconstriction occurs due to the sympathetic activation, and cell growth and sodium and fluid retention starts appearing. Hence, it increases the blood pressure. So to block this, angiotensin receptors are going to be effective. Coming to calcium channel blockers. In the calcium channel blockers, usually muscle constriction or muscle contraction will have to be blocked with the use of calcium channel blockers, and which will stop the depolarization of L-type voltage gated channels, which ultimately decreases the release of calcium stored from the sarcoplasmic reticulum. Hence, it decreases the interstitial calcium levels inside the cardiac myocytes and decreases the muscle contraction, leads to muscle relaxation, and as well as decrease in the blood pressure. Beta blockers. The beta blockers usually affect on the beta 1 adrenergic receptors and decreases the G protein coupled receptors, ultimately decreases the levels of adenylyl cyclase enzyme responsible for the conversion of ATP to cyclic AMP, and that will lead to decrease in phosphorylation, leads to decrease in the calcium input inside the cells or cardiac cells, and this will decrease the heart rate and also calcium released from the sarcoplasmic reticulum. Hence, there is a decrease in the contractility if we block the beta-1 receptors. Coming to how the diuretics affect. Example, one of the classification under diuretics is thiazide diuretics. If thiazide diuretics have been administered, it will increase the sodium and water excretion, and that leads to short-term and long-term effects. If short-term effect is there, it will decrease the blood volume and hence it decreases the cardiac output. And in the long-term effect, it's going to decrease the sodium content of the smooth muscles, and sensitivity of the vasopressors will also be decreased, and ultimately leads to decrease in the peripheral vascular resistance, and hence there is a decrease in blood pressure, elevated blood pressure. Next, coming to direct vasodilators. Vasodilators are having its direct actions on the blood vessels. For example, if we block the calcium from L type of calcium channels, so nicaridopin and clevidipines are some of the examples. And if we block at the level of activation of cyclic GMP through the nitric oxide, examples nitroprusside and nitroglycerin, so there is a chances that the relaxation will appear. And if we start blocking at the regions of G protein coupled receptors, and that relates to the dilation of the vascular smooth muscles. Coming to alpha blockers, if you block the alpha receptors, phospholipase C will be decreased, and the conversion of inositol triphosphate and diacylglycerol will be decreased, and hence that leads to the vasodilation, which affects directly the heart with decreasing the afterload and preload. And coming to the central alpha agonists, if we give the agonists which are relating to the affecting the central nervous system, that's the clonidine. If we are giving, for example, the clonidine is given and it affects on the alpha 2, which will activate the central alpha receptors, and it will increase the firing of vagal nerve, and vagal nerve is an acetylcholinesterase. It will increase the firing of vagal nerve, which is directly affecting the sinoatrial node, and also it decreases the firing of sympathetic nerves, and hence there is a decrease in the total peripheral resistance and the venous return, and ultimately there is a decrease in the heart rate and decrease in the PP. These are some references. Thank you.